Insulin resistance and insulin deficiency are two critical factors at the heart of many diabetic conditions that affect how the body manages blood sugar. With insulin resistance, your body's cells become less responsive to the insulin hormone, resulting in high blood sugar levels, since insulin can't do its job to regulate glucose effectively. In contrast, insulin deficiency occurs when the pancreas fails to produce enough insulin, leading to a similar outcome where glucose accumulates in the bloodstream. Treatments vary, with insulin resistance often managed by lifestyle changes and medications that improve insulin sensitivity, and insulin deficiency frequently requiring insulin therapy to maintain proper blood sugar levels. Key risk factors for insulin resistance include obesity and a sedentary lifestyle, whereas genetics and autoimmune reactions are significant contributors to insulin deficiency. Here's a deep dive into the nuances and detailed aspects of both conditions. Pathophysiological mechanism, insulin signaling impairment versus insulin production failure. Insulin resistance and insulin deficiency form the core pathophysiological mechanisms underlying type 2 and type 1 diabetes, respectively. In insulin resistance, the body's cells do not respond properly to insulin, meaning more insulin is needed to get glucose into cells. This places an overbearing demand on the pancreas. Over time, this can exhaust the pancreas, potentially leading to impaired insulin production. On the other hand, insulin deficiency is characterized by the pancreas's failure to produce sufficient insulin, often due to autoimmune destruction of the insulin-producing beta cells. Differentiating these mechanisms is crucial for treatment, as insulin resistance can often be mitigated through lifestyle changes, whereas insulin deficiency typically requires insulin replacement therapy. Glucose homeostasis, hyperinsulinemia versus hypoinsulinemia. Insulin resistance and insulin deficiency represent two divergent yet interlinked disorders affecting glucose homeostasis. Insulin resistance occurs when cells in the body don't respond adequately to insulin, leading to elevated blood glucose levels, as the hormone's facilitatory role in glucose uptake is diminished. This often results in hyperinsulinemia, where the pancreas compensates for resistance by producing more insulin. Conversely, insulin deficiency characterizes diseases like type 1 diabetes, where pancreatic beta cells are destroyed, severely limiting insulin production, which can lead to hypoinsulinemia. Understanding the nuanced interplay between these conditions is crucial, as interventions for one, e.g., insulin injections for deficiency, might exacerbate the other, worsening resistance. Compensation ability, potentially reversible versus irreversible beta cell loss. Insulin resistance and insulin deficiency are pivotal in understanding diabetes pathophysiology, where insulin resistance refers to the body's diminished ability to respond to insulin, a condition often linked to obesity and a precursor to type 2 diabetes. Insulin deficiency is a hallmark of type 1 diabetes, characterized by the irreversible loss of insulin-producing beta cells in the pancreas, often due to an autoimmune attack. The compensation ability of the body varies greatly. In insulin resistance, lifestyle changes like diet and exercise can enhance tissue responsiveness to insulin, potentially reversing the condition. Conversely, insulin deficiency typically necessitates lifelong insulin therapy, as the beta cell loss is permanent and the body can no longer produce sufficient insulin on its own. Understanding this differential diagnosis is crucial for tailored therapeutic strategies and patient management. Common etiology, obesity-related versus autoimmune destruction. Insulin resistance and deficiency are critical distinctions in understanding diabetes pathophysiology. In insulin resistance, typically associated with type 2 diabetes, cells fail to respond to insulin effectively, often due to obesity and an unhealthy lifestyle, leading to impaired glucose uptake. Conversely, insulin deficiency is central to type 1 diabetes, where an autoimmune attack destroys pancreatic beta cells, resulting in little to no insulin production. Identifying the underlying cause is crucial for effective management. Lifestyle interventions and medications that improve sensitivity are key in insulin resistance, while type 1 diabetes requires lifelong insulin replacement to maintain glycemic control. Addressing obesity can prevent or delay the onset of insulin resistance, illustrating the importance of both primary prevention and tailored treatment strategies in managing these conditions. Treatment approach: lifestyle modification versus exogenous insulin administration. Insulin resistance and insulin deficiency, while both related to the disruption of blood glucose regulation, necessitate distinct treatment strategies. In insulin resistance, commonly seen in type 2 diabetes, the body's cells become less responsive to insulin. Managing this condition often involves lifestyle modifications, such as diet changes, increasing physical activity, and weight loss, which can enhance insulin sensitivity. Medications may also be prescribed to improve the body's insulin response. In contrast, insulin deficiency is a hallmark of type 1 diabetes, where the pancreas produces little to no insulin. Here, the cornerstone of treatment is exogenous insulin administration, requiring patients to regularly inject insulin to maintain normal blood glucose levels. Monitoring and adjusting insulin based on diet and activity are crucial to prevent both hyperglycemia and hypoglycemia.